Time start.
Good evening, everyone. The aim of my presentation is to discuss that anterior and nasal transposition of inferior oblique is an effective way to treat strabismus ursoductorius through different cases. So the history of IO weakening procedures starts from myectomy and recessions, which though is a very strong surgery, still has a postoperative overaction in about 1.7 to 5% of cases. Thereafter, anterior transposition was developed, which did have the complication of anterior vision syndrome. Keeping that in mind, anterior nasal transmission was developed, which reduced this risk. So ours was a retrospective observation study, and the inclusion criteria was all the patients of strabismus ursoductorius with severe inferior oblique overaction who underwent anterior nasal transposition of inferior oblique and had a minimum follow-up of 12 months. The data that was compared pre and post-operatively was motility, torsion, deviation, and inferior oblique overaction. The surgery was done by the silent technique described by Sejar et al., in which the inferior oblique was disinserted and reattached to the sclera 2 mm nasal and 2 mm posterior to the nasal extent of inferior insertion. So a total of 13 patients were included. The mean preoperative hypertropia improved from 17 prism diopters to 1.69 prism diopters, and the correction thus achieved was around 15 prism diopters. The torsion reduced from grade 4 to grade 1 with elimination of inferior oblique overaction in all patients, and anti-elevation was induced in just one patient. Just for example, this 25-year-old female presented to us with diplopia in primary gaze, which increased in up gaze. On examination, the Hirschberg test revealed a 15-degree hypertropia in the left eye with severe inferior oblique overaction. We did ANT for her, and post-operatively she was orthotropic and the diplopia had disappeared. So this is a summary of all cases. As discussed before, the deviation reduced from around, the mean reduction in deviation was around 15 prism diopters with elimination of inferior oblique in all the cases. So inferior oblique anterior nasal transposition is a relatively new technique which corrects a relatively larger hypertropias as compared to other techniques as per some studies, and with its main advantage being the reduced risk of anterior vision syndrome. Our study reveals that it can give a mean correction of around 15 prism diopters. To conclude, long-term results do indicate that inferior oblique ANT can be effectively used to treat the large hypertropias of strabismus ursoductorius. Thank you.